Hello and welcome to this special edition dedicated to the topic of COVID-19 and our community responses to this pandemic. I am Carol Merton, and first of all, I want to express a sincere and heartfelt thank you to our Medical Officer of Health, the Public Health Unit staff, our community service providers and support agencies, our first responders, our hospitals, retirement homes, and long-term care facilities, and so many others for their prompt action and ongoing efforts to keep our community safe. We are all together in this exceptional and certainly ever-changing situation. We are all neighbors doing our best to care for and to support each other. Rogers TV will be providing you with current information from our community agencies and from our elected officials. This information may change rapidly. To stay current with the situation, we encourage you to go on to the Public Health Unit website at publichealthgraybruce.on.ca, listen to the radio, and watch Rogers TV for updated information. Today, I am welcoming to the program Chief Craig Ambrose, Police Chief Craig Ambrose, who is going to be talking to us about the police services, things that are occurring as a result of this pandemic, and also what you expect from the community and how the community can assist police services. Craig, thank you so much for being on the program today.
Thank you, Carol.
So, where are we and where are we headed?
Well, that's a really good question. I wish I knew the answer to where we're headed. That would certainly make planning for this a lot easier. But certainly where we are right now is an unprecedented situation and uncharted waters for all of us. And whether that's healthcare sector, policing, any first responders. It's an ever-changing situation, and you think you're going to know what your day is going to bring, and the next thing you know, something happens and it's completely out of whack again. So it's been a real challenge, especially for policing and keeping up with things.
Well, as we chatted just before the program started, all of a sudden your day instantly changed from what you expected, even just as we were talking before.
Yeah, absolutely.
Yeah.
So a lot of the things that we've done on the police service end of it is tried to plan for minimizing our contact. You know, the not social distancing, but physical distancing is one of the things that's really been promoted for the public, and we're trying to implement that as best as we can. So our doors are now closed, and everything that we would need or could need is either available online or through a call to the police service. We've implemented some online records check systems in the last week that we got going, so you don't have to come in here and speak to us and meet face to face. We've dealt with people who are coming in for parts of their terms and conditions. They're able to sign in and come and just see people through the door, and we're facilitating that response. We're really trying to minimize our contact with the public. All the calls that come in through our dispatch and comm centers get screened for COVID-19, so you'll be asked a number of questions there about how you've been feeling, whether you've been traveling, those types of questions, so our officers know how to prepare on their arrival. It's not that we're not going to respond, it's just how we respond and how we protect our officers and the individuals, because our officers are going around to a lot of places and dealing with a lot of people that they don't know. So we're just trying to minimize contact for everybody. So
this has been a quick change around in your whole process and procedure, I would suspect.
Absolutely, and it hasn't been without challenges, you know, getting all those things implemented and changes made, and at the same time trying to work around minimizing our staff exposure. So some of our staff that are able to are working from home, and as a result, they're able to do those records checks and things online. But that certainly puts a burden on our IT staff, who have to set up all those secure portals. And policing is very different than it is with any other business because of the security involved. So our IT people have been exceptionally busy and really met the challenge really well with that as well. So we have people working from home. We have officers that are sometimes out doing some enforcement that are now responding and using the telephone. So any type of call. We went through the list of all the types of calls that we handle and evaluated what types of calls can we handle without an officer having to go out to the scene and speak to the individual and deal with things, or if they can take as much of the information as they can over the phone, and then from that point contact the individual and say, okay, well, we'll be around and look at something, or we'll look at the damage on your vehicle, or we'll do that, but you don't need to be there because we have all the information, and you don't actually have to have a face-to-face conversation with the individual. So yeah, it's been a challenge. We're trying to adapt day by day to try and make our exposure and the public's exposure that much less.
So a way the public could help is if they had concerns to call in and to talk to someone about the concerns. There are police cars still around, out and about, though. I've noticed them when I'm out walking my dog.
Yeah, absolutely. For us, as much as we've changed what we're doing and how we're doing it, we still maintain the minimums that we have all along. So the officers on the street will still have the same number of officers on the street, the same response if there's an emergency, the same number of people out there working, and then we're doing provisions and planning on how to keep that and make sure that that's maintained throughout any type of extended period, or if there gets to be absences and sickness, we're planning for that as well. So that's the second portion of it, not what we've done, but what in the future we plan on doing in order to maintain that service. But like you say, the police are still out there. They're still responding to calls. Our calls for service are probably about the same. There have been a number of things that we're not getting complaints about, and with a lot less traffic on the roads, we might not be getting the same number of accidents, but we're still getting other complaints and other calls related to the pandemic and related to people gathering and different things like that. So it's a different type of call, but we're still getting the same quantity basically.
Yeah. I wanted to ask you about, we're hearing more and more the restrictions on gatherings, on the numbers. And lately, the most recent conversation is about enforcement. I'm wondering if you can share your perspective or how you think this may evolve should enforcement be required.
Obviously, we've been provided a lot of service by the Ministry of the Solicitor General. I can't say enough about the response that they've done for this, and their staff are working extra hours as well, getting everything going. And the response from the government for us and assisting us has been overwhelming. I've spent Sunday evenings on a conference call with the Premier and members of the Solicitor General's office. So kind of unprecedented, but certainly everybody's working around the clock to make sure that everything is going there. So they've provided us with enforcement hotlines where if we have a question and we need some idea of what to do if it's an unusual circumstance that isn't covered or that wouldn't be your routine one that would come to mind, that you can come up with an answer. They've got police numbers that we can contact, so they've been a great assistance with that. Certainly the biggest thing for everybody is enforcement is a last resort. Obviously, with the courts and the backlogs and the delays, it's going to cause issues moving forward if there are enforcement matters to deal with. But I think the biggest thing is, during this trying time for everybody economically and for everything, the biggest thing is voluntary compliance and education, and that's where we're starting ourselves, is with meeting with everybody and any complaints or anything that we have. Even before the enforcement provisions were enacted, those people that we said that have been moved into the telephone duties, they were calling people and just educating people over the phone and trying to respond and saying, listen, if you've just gotten back from holidays, this was before the Quarantine Act came in and everything else. Understand the importance of self-isolation. Understand what self-isolation means. Understand that doesn't mean stopping and getting groceries on your way home. It means going home and making some arrangements for somebody to bring you something. And then how important that is. So anybody that we could identify and complaints or people that we were notified about, we reached out and made those telephone calls to try and eliminate a lot of those contacts that were potential contacts for people who may be in a high-risk situation. So.
In other words, it's not an option and it's not a choice. It's absolutely essential that people comply with the directions that have been given around social gatherings and isolation.
Absolutely, and I think you see with the orders that the government have enacted, they started out with gatherings of 50. Now it's down to gatherings of 5, and there are certain exceptions to those, and those just came out over the weekend. But I think it's important to realize that the fines involved are significant, up to and including incarceration. And I think people have to understand how serious this really is and how important it is that they isolate themselves for the betterment of everybody. And there's still people that you see that are gathering, and we get complaints on a regular basis. There were complaints about the number of people at the grocery store and making a family outing of going to get groceries. Well, it's unfortunate. Some people are in the situation where they have to take their children with them because there's nobody else to care for them, and you can't leave them at home alone, and you don't also want to bring anybody else into your home. But really, if you can do it, it's not a family outing anymore. It's not three people walking into a store. It's one person getting what they need, getting it, and getting out and going back home and self-isolating.
So it's a whole new way of looking at things these days. Do you anticipate people may push the edges the longer that this goes on for? I mean, we're generally social creatures. Do you anticipate that it may be an issue as we move forward?
Yeah, I'm not sure whether it's going to become an issue or whether there's going to be enough information out there that people are going to realize the severity of it. I think it could go one of two ways. As you see the death tolls in some of the other countries and the number of deaths that are being reported and the number of cases that are being reported, especially in the United States and Italy and some of the other countries, people are either going to go one of two ways. They're going to say, well, it's not affecting us here in Canada to the same amount because we have been good about socially isolating. Our government put those restrictions in place very early before it got to the spread that some of the other countries have, learning from what happened in those other countries. So it's either going to get to the point where people are say, well, we're all right because we've done this, and then 2 weeks from now, and that's the biggest problem, is it'll be 2 weeks from now people will realize, oh, we shouldn't have done that, and the restrictions are there. I think you see that in some of the cases with some of the clusters that you're seeing now around Canada. So it's either going to go that way where people are going to say, we've done a really good job, and then they're going to go out and see everybody, or they're going to read in the media about how bad it's been and hopefully then restrict their activities even more. So I'm not sure which direction that's going to go.
I know that if we had a crystal ball, right? So my other comment is, we did expect that there would be positive cases from travel. But now here in our area, my understanding is there's a community transmission. Is that your understanding as well?
Yeah, that's correct. And I will say the Grey Bruce Health Unit and Dr. Era in particular have been outstanding for us in this whole situation. I haven't direct any inquiries or any questions, I can feel free to call him, and I always get an immediate response. It's been exceptional. But yes, from what I understand, today was the first reported case of community transmission, or there's no way of saying that it was related to travel or contact with somebody from travel. And I think Dr. Ayers has been very good about the whole situation and explaining it to us that it's just a matter of time before that took place. So it really didn't come as a surprise to those of us who have been listening to him, and he's been bang on with everything else that he's been talking about, and we're very fortunate to have somebody with his credentials and his experience here in Grey and Bruce County. But this is the first, and that's a bit of a game changer, because now people maybe that's the part that some people now are going to say, oh, well, if it's not somebody that traveled and it's out there in the community, and where did they get that and how did they come in contact with it, then maybe that'll be a wake-up call to everybody else. I certainly hope it will be, because everybody has to take that cue.
To me, it is absolutely a red flag that, okay, it is out in our community, it can transmit in our community, and basically we need to keep each other safe by staying home when at all possible, and that's critical.
Yeah, absolutely. I think you saw that on the weekend, just with the fact that Grey Sauble Conservation closed all their parks and trails and things, is that people are out and about, but some people don't understand that you can't come within 6 feet of somebody, and you've got that bubble around you, and it's the proactive measures, it's the things that people are doing that may seem like a bit of an inconvenience, but they're crucial in making sure that this is limited in the exposure.
My understanding is that you are part of an emergency management team and that you have regular meetings and conversations with city staff. Can you outline a little bit how that actually works?
Yeah, I guess I'm the parts of emergency management teams about 4 times a day right now,
Oh my
depending on who the emergency is with. But no, I'm part of the city's emergency planning team, and we talk on a conference call every morning and discuss the changes and updates from overnight and what's gone on, and make sure that everybody's on the same page and make sure that everybody's aware of what's going on in different areas, because I'm not going to necessarily get that information from other departments in the city. Partly because we're over here in a building by ourselves, but partly because in a normal situation, it might not affect me. But now, certainly, we're in a lot closer contact, and we're meeting regularly just to make sure that everybody's on the same page and everybody knows those changes. As well, any of the updates that come out of the Emergency Operations Center in Toronto for the province, then we make sure that we're updated with those as well. And with the city declaring a state of emergency last week, then there are certain rules and certain features that have to go into place so that everybody's on the same page and everybody's aware, and everybody that wears a hat around that table and in those situations is on the same page. So yeah, those meetings take place, but we're also meeting regularly with our courts, or the people in courts, and because that's been a situation that's been very dynamic and changing every day. There's a lot of court systems really haven't changed a lot since the early days. The judges in the chambers and the clerk is there and the reporter's there, much as back hundreds of years. But this has certainly forced the whole system to update and go into a different mode, and bringing in videos and bringing in links with audio and video transmissions, and having links back to correctional centers and links to the police station. It's really changed the whole ministry and the whole court system in a big hurry. And that was a changing by the minute sometimes, as opposed to changing by the day, and that's been updated as well. All the municipal chiefs for Grey and Bruce County, we talk every week on a chat, and with Dr. Era and all the fire chiefs, and then following that, all the chiefs of police have we have a meeting as well, so that we can talk about staffing, we can talk about planning for the future, because we're all in the situation where we may end up having to help each other. So there's a number of future considerations that we're working on, and how we're going to plan for that, because we have to have a plan in place that meets the needs of the community. So we have staffing plans in place where you may see some familiar faces from the past back in a uniform, if that's approved by the ministry. That was part of the call with the ministry, was, what do you as the first responders and what do you as the 50 chiefs of police across the province need from us as legislation in order to get through this COVID-19 pandemic? And we all said, we have to have the ability to bring some people back and work outside collective agreements in order to staff that. And our association's been excellent working with them in order to work together in order to come up with staffing plans and models so that we can adequately support the community and have those staff in place.
It certainly sounds like this pandemic is transforming how police services and other services do their business. By necessity, but in the future, who knows whether some of this transformation will stick.
Yeah, I think, and I mean, when we're talking about some of the alternative call response things and not necessarily having an officer show up at your door, that's some stuff that's already happened in a lot of the big cities, because through the call demands and demands for service that was such that they can't do it anymore. We were fortunate in Owen Sound that we still had the staffing, we still had the resources, and people still want to see the local police, because you have to remember, when they're calling that day, that's the worst day. That could be the worst day of their life. That could be the only time that they're calling the police for them to come out and help them. And they want to see a police officer, and they want to, and speak to the police officer and share their story with the police officer. So it's important that community contact, and it's not something that I take lightly. I think it's important that we try and get back to a normal where that is the normal again, where we have the ability to go out and do that. But maybe some of the things aren't going to go back that way. It depends a lot. It depends on how the world changes as a result of this.
For sure. So it sounds like you're not getting many days off. How are you taking care of yourself?
Well, actually, when it first started, I was actually on a couple of days off, so it worked out that I was busy while I was away, but I was back, and then I had to work from home for a few days because of a cold, and I just spent all day on the telephone, so it really didn't matter one way or the other.
Yeah.
But actually, overall, mental health for all of our officers has always been one of my priorities. It's going to be a challenge moving forward, especially if we see some of the things happen here in Canada and in Owen Sound and in Grey and Bruce counties that have happened elsewhere in the province and elsewhere in the world. We're behind where other places are in the world. And when you talk to Dr. Era, he's very open and saying, you know what, when this reaches, if it reaches community spread, which it's going to, and he said when it gets to that point, you have to understand that you're still going to have to staff your front line, but you're going to have 20% of your staff off at any one time based on modeling from other countries. So he's been very helpful for us to help us plan for what we need to do in the future. It's going to affect probably 35 or 40% of your staff, but 20% will be off during one time. So in order for us to figure out and plan and meet those needs, as far as me personally, you know what, I'm more worried about my people out there on the road, and they have a much higher risk of transmission than we do here overseeing things, and we're planning on how do we keep our members safe and healthy, and how do we get them home to their families every night, and how do we limit the exposure. So we've been sending out a lot of messages, sending out a lot of updates on spread of the virus, as much information as we can to the people so that they can feel comfortable about how they're dealing with the situation, because it's really, if you know about the transmission, if you know about the virus, you're in a much better position to deal with that.
I know certainly from what I'm hearing and from what I'm observing, this is true leadership when people are rising to the challenge, working together, and building on the partnerships that have existed but are becoming even stronger. But it is at a price. It's a price to everyone, because leadership is not always easy. So I commend you for what you're doing. I want to ask. My pleasure. I'm asking now about how the community can support you. Police services, they are supporting our community and will continue to do so. But how can the community support police services?
Well, certainly, if they have any complaints or any concerns that need to be addressed, we're always here to take your calls. Anything coming in through emergency 911, make sure it is an emergency before you call that number, because they are busy, and even just adding those few screening question calls to every call that comes in through our police service adds time and taxes our resources. So really my big thing would be, don't overburden the emergency 911 system. If there's other methods and other numbers that you can call, look on the internet, look for advice. If it's not an emergency, call a regular routine number, and we'll have an officer contact you about that. If it's not an emergency, it might not be immediately, but somebody will get back to you rather quickly. And that's probably the biggest way they can support us through all of this.
Yeah. So certainly if people have concerns, I've heard 211 is a good source of information. Can you think of other ways people can get information? We've talked about the Public Health Unit website. Certainly going online to access resources, but they need to be cautious about what they read online.
Absolutely. I mean, the Government of Ontario has an awful lot of information online. And they also have a lot of numbers for people to call if they have any questions or concerns. They have numbers to say whether or not you're an essential service or not an essential service. They have numbers to ask about whether what your gathering is and whether or not you can have your gathering. They have hooked up and set up a lot of things in a very short period of time. But really, the internet's a great source of information, but make sure it's you going out and looking for the information and not somebody coming to you with looking for information, because that's another thing, is that whenever there's an opportunity, or whenever there's something like this where there's some fear of the unknown, you have to be concerned about people who are going to prey on the victims of of that void in knowledge, and we've seen it happen. And I'm not sure about locally, but I've heard some cases where people have been offered, testing for COVID-19. Well, the testing is all done through the government. It's all done through the Ministry of Health. There aren't private tests. There aren't private labs out there offering that testing. Same way with emergency medical equipment, disinfectants, things like that. Those offers that you're going to get. If I were you, anybody that reaches out to me, I'd be cautious about anybody that I reach out to. Then I'd be a little more comfortable if they have a website, if they have an online presence or a store that you can go to, reputable businesses, because there are people out there who are simply looking to prey on individuals who don't have the knowledge about what's going on around this.
So be even more cautious about fraud, and even more cautious about releasing your personal information, your banking information. People get distracted by this pandemic and may be more vulnerable. Would you agree?
Absolutely. That's a concern that the people that are out there using technology to defraud people, they're seeing this as a great opportunity. And be very vigilant. Don't give out your personal information. Don't give out any of your banking information. If you think it's too good to be true, it will be. If you think it's, wow, is that ever a great coincidence they contacted me today when I was thinking about that? It's probably not a good coincidence that they've reached out and contacted you. So if you're looking for some information, certainly, or if you think it's been a fraud, certainly report to the Canadian Anti-Fraud Centre, and you'll probably, or go online with the Canadian Anti-Fraud Centre, and they'll have information about scams and things that are going on right now, especially relating to COVID-19.
So we have about a minute left in the program. So if people wanted to look up information around police services, where would they go to actually look for that information?
Certainly they can go to our website and get that information. If they're looking for information about the new legislation, the Ontario government website has all the emergency orders listed there, and it details what orders are in place and what information is available, and it lists all the restrictions and what the police services are responsible for enforcing. And we take a lot of our direction from public health as well, and we appreciate all their help and their assistance in getting us the information that we need, because really this is a public health emergency and a public health crisis, and although we're there on the front line, we're supporting them through this endeavor, and we really appreciate all the help they've given us.
I want to thank you for being on the program and for sharing this information. I wish you all the best, and I thank you and Police Services for the leadership and the care that you're providing to our community. Thank you to our viewing audience. Please take care, stay safe, stay healthy, and take care of each other. Thank you.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Trying to learn a new language.
Keep your distance. You can make my
With the economic impact of COVID-19 deepening, food banks across Canada are concerned about not having enough food to meet the demand, with many reporting only a 2-week supply remaining. That's why Rogers is partnering with Food Banks Canada in this critical time of need. By donating